Within the medical community, there is a growing understanding many mental health problems start in childhood. Half of all adult cases showed symptoms before age 14, and yet fewer than 25% of children with diagnosable mental health problems get treatment. Here with the story is WSJ Health and Science Senior Editor Melinda Beck. Melinda, thanks so much for being with us.
You're welcome.
Why is it that so few children who seem to need some intervention are getting it?
One reason is that there's just a shortage of mental health professionals for children. Only about 8,000 child psychiatrists in the U.S. for 75 million children, about a quarter of whom have some symptom of a mental health problem at some point.
And how closely do the regular sort of pediatric checkups look into the psychological issues of children?
It varies a lot, but in general, pediatricians have about 15 minutes to cover everything from ear infections to growth issues. And when parents do raise questions, which many of them do, in many cases, the pediatrician doesn't have time or the training to really advise them.
And yet there's a growing recognition about this. So is it beginning to change?
Well, a small but growing number of pediatric practices are now embedding child psychiatrists, psychologists, social workers, and other mental health professionals right in their practices to try to ameliorate this shortage.
And what are pediatricians saying are the benefits of this sort of integrated care?
There's a very long list, but one is when there does seem to be an issue, instead of handing the family a list of names that they can then go and try and get an appointment with, which often takes months, the pediatrician can actually walk the family down the hall and do what's called a warm handoff. Say, here's my colleague. He or she, has a lot more experience in this than I do. You can meet, you can make an appointment. And there have been a lot of studies that show when a family does meet somebody right then and there, they're much more likely to make an appointment than if they had to go look on their own.
To follow up. And in terms of treatment, how helpful is it to start treatment for some of these issues as early as possible?
Research is still just developing in this area, but in many cases, experts think that if they catch the signs of anxiety, mood disorders like depression, those kinds of issues early, and give both the kids and the families sort of the skills to combat some of these difficult feelings, they really can stave off problems later on.
And for parents, let's give some ideas of some of the red flags, because of course I think an anxiety attack, a very deep anxiety attack, will tell a parent that their child perhaps needs to speak to someone, but there are other sort of less telling signs as well, like stomach aches and headaches, correct?
Well, a lot of this very gray area, very squishy, and that's one reason it's so good to have the mental health professional and the pediatrician be able to collaborate on this. The pediatrician knows this patient, hopefully, for many years at a time, knows the family and can be alert to say, this is a really different change in behavior,
right, or
these stomach aches and headaches are really kind of interfering with Johnny's ability to go to school and get out of bed. And let's really talk about this and figure out what's going on before it gets worse.
And quickly, what advice would you have for parents who are looking for an integrated program like this? And what about insurance? Insurance
has been a big barrier to these programs catching on. A lot of plans just don't know how to reimburse for a collaborative team like this. Some of them have different networks and different management companies for mental health, and they don't include pediatricians. What parents can do now is just kind of be alert to these programs going on in their areas. They tend to be more common in academic medical centers where there's a lot of different professionals to draw on, and there are a lot of efforts to get them to work together these days.
Melinda Beck, thank you so much for all that very important information.
You're welcome.